listening to the Sickle Cell Action Network, a weekly internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Mass Therapeutics. We're coming to you live from Indianapolis, Indiana. We're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell, quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those lives every single day. I currently serve as the president and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day, I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. For being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. This show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is, not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We've designed the show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we're pleased to speak with a true sickle cell warrior who knows what it's like to surpass the life expectancies generally given to patients with her illness. We're honored to have Miss Darlene Ransom in studio with us today. If there is anybody that knows how to live with sickle cell, this is the woman. We're sure that you'll learn something from her, and we're grateful that she's here with us today. Before we get to today's topic, however, I want to share some of our upcoming topics with you so that you'll know what we're going to be doing. In future weeks, we'll cover such topics as sickle cell narcotics dilemma, traveling with sickle cell, and many, many others. So as you can see, we are serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. This particular article that I would like to share with you is again showing that there is more interest and awareness in sickle cell disease, and that people are responding to the many needs that are impacted by sickle cell disease. And the title of this particular article is New App Would Increase PCP Awareness of Sickle Cell Guidelines, Help Connect with Specialists. The article reads, researchers from Duke University and the University of Pittsburgh have developed a mobile app to provide PCPs or primary care providers with guidelines, algorithms, and a way to communicate with local specialists regarding sickle cell disease. The team developed the iOS-based toolkit after finding that few PCPs serving patients with the disease were aware of new sickle cell guidelines or had been in regular communication with a specialist. Publishing their data in the Journal of Primary Care and Community Health, they further concluded that a majority of PCPs nonetheless have a favorable attitude toward learning about the guidelines and co-administering hydroxyurea with a specialist. The researchers plan to test the app's feasibility and acceptability among PCPs before making it available through iTunes. Sickle cell disease is a complex, chronic disease requiring care from a multidisciplinary team, including a hematologist, other specialists, and PCPs, said Joseph Lunieri of Duke University Medical Center in Durham, North Carolina. To better understand PCP attitudes towards SCD care, awareness of 2014 guidelines, and comfort at the prospect of co-administering hydroxyurea with a specialist, the researchers partnered with Community Care of North Carolina to identify PCPs assigned to patients with sickle cell disease and Medicaid across the state. Network administrators administered a web-based questionnaire among 131 PCPs who had at least 5 patients with sickle cell disease. The questionnaire included 12 self-reported items with a yes/no or a 1 to 5 Likert type scale assessing attitudes regarding sickle cell care and co-management and awareness of guidelines. 53 PCPs completed the questionnaire. According to the researchers, 73% of those who completed the questionnaire reported feeling comfortable with the number of patients with sickle cell disease in their practice. However, 67% reported having infrequent communications with a sickle cell disease specialist, and 66% were unaware of the 2014 sickle cell disease guidelines. Still, 76% said they would frequently refer to the guidelines once they were made aware, and 51% expressed comfort with using mobile apps to access and receive further information via email. In addition, 65% reported being comfortable co-administering hydroxyurea with a sickle cell disease specialist. PCPs in North Carolina demonstrated a favorable attitude toward receiving the sickle cell disease guidelines and co-managing hydroxyurea with a specialist, yet few of them currently were aware of these guidelines or had regular communications with an SCD specialist. Lunera said, in response to this gap in care, we have now developed a mobile-based SCD toolbox specifically to assist PCPs to utilize SCD guidelines, algorithms, and a method to communicate with SCD specialists. So interesting that there are people developing other apps or new apps to try to ensure that primary care providers have access to the latest guidelines that are out there for sickle cell disease care. Our next article is titled NMC to Start 4 Sickle Cell Disease Test Centers. This story comes to us from India, Nagpur in India, and it reads like this. Civic Agency Nagpur Municipal Corporation, or NMC, has decided to start 4 sickle cell disease test laboratories in health centers that it runs. They will be set up by Pakpayoli Maternity Home, Indira Gandhi Hospital, Sadar Diagnostic Center, and Mayhow Diagnostic Center. The laboratories will be operated with the help of private organizations and non-government organizations. NMC has invited an expression of interest from interested organizations for this purpose. The laboratories will remain open from 8 a.m. to 2 p.m. on all working days of the NMC. 2 tests will be conducted by the organization. The first is the solubility test. If the readings indicate possibility of sickle cell disease, then the HB electrophoresis test will be done. NMC will provide 100 square feet of space to the organizations in each of the 4 health centers. It will also pay for electricity and water used by the organization. However, the salary of the testing personnel will have to be borne by the selected organizations. Municipal Commissioner Shravan Hardikar said that outside help had been sought as NMC health staffers did not have expertise in operating sickle cell test equipment. There are many NGOs, or non-government organizations, which do these tests under National Urban Health Mission and National Rural Health Mission. Therefore, we decided to use their expertise for the benefit of the citizens, he added. So, our last article for today, another interesting story with a lot of promise, and this is written by James Radke, PhD. It's called Can Umbilical Cord Blood Cure Sickle Cell Anemia? And the article reads like this. Doctors at UCSF Benioff Children's Hospital, Oakland, have transplanted the first patient in a trial to test the safety and efficacy of transplanting umbilical cord blood to treat sickle cell anemia. The transplantation, called Cord-In, is being developed by the Israeli-based company Gracefully. If successful, this treatment would be a single procedure that would theoretically cure the patient of sickle cell disease. In a press release, Gamida Cell CEO Dr. Yael Margolin said, "The successful enrollment and transplantation of our first SCD patient with Cord-In as a single graft marks an important milestone in our clinical development program. We are eager to demonstrate the potential of Cord-In as a transplantation solution to cure SCD and to broaden accessibility to patients with rare genetic diseases in need of bone marrow transplantation." Dr. Margolin added, "In the first phase of the study with SCD, The expanded graft was transplanted along with a non-manipulated umbilical cord blood unit in a double graft configuration. In the second phase of the study, we updated the protocol from our first phase of the study so that patients would be transplanted with cord in as a standalone graft, which is expanded from one full umbilical cord blood unit and enriched with stem cells using the company's proprietary NAM technology. Much like gene therapy, the idea of using one procedure to cure a patient would be ideal, but at the same time, it may make it difficult to market. It is fairly easy to market a drug for a chronic condition at a price of $100,000 to $300,000 per year if the treatment keeps them alive and the number of patients is extremely small. But if the number of patients is really small and they need only one treatment, how much do you charge for that treatment in order to make a profit? Gracefully Cell is arguing that the financial burden of treating patients with sickle cell anemia over their lifetime is estimated at $8 to $9 million. So according to Gracefully, anything below that $8 to $9 million for a single procedure would be a savings. Preliminary data from the first part of this ongoing study should be available later this year. As I've said many times on the show, there are a lot of people working on a lot of angles, trying to find ways to make life with sickle cell better and also to cure it altogether. So we are also going to anxiously await the results of this particular study regarding umbilical cord blood curing sickle cell disease. That is today's Sickle Cell News Update. We're going to take a break, and when we return, we're going to start talking to the lovely Miss Darlene Ransom. This is the Sickle Cell Action Network. Welcome back to the Sickle Cell Action Network, and I am Gary A. Gibson, your host, and I'm very delighted that we're going to have an interesting show today, Aging Gracefully with Sickle Cell. Before we actually get into that, though, something's on my heart, and that is that there are a couple people that I know of that are struggling with sickle cell today, and they're very, very important people to me, and I just would like to give a shout out to them. And ask for those that are listening to lift them up in your hearts and your prayers. Tosin Ola, the founder of Sickle Cell Warriors, and also Dr. Lakia Bailey, the founder of Sickle Cell Community Consortium, as I understand it, are both in a sickle cell crisis at this point, and they're having a difficult time. So think so highly of them, and I watched them in Los Angeles working so hard to put on the third annual symposium for sickle cell patients and families, and the entire time I was afraid that they were going to end up sick, and they are, and so I'm asking that people think about them and raise them up in your prayers. Also would like to give a shout out to P. Allen Jones, my friend from California, the author of I Only Cry at Night, who's been on our show before, and she's a loyal listener, so thank you for listening. I am honored, honestly, to have in the studio with me today a person that I have known for decades, and true, as I said in the introduction, a true sickle cell warrior. I would like you all to get to know Miss Darlene Ransom, and first thing I'm going to do is actually welcome you to the show, Darlene.
Thank you for having me, Gary. I'm glad to be here.
All right, so this is what I do every week. Every time I have a guest, I say, please tell us about yourself so that the people that are listening get a sense for who you are and who they're listening to. So I usually ask things like, where were you born? How old are you? And that's going to be critical today. You have to be honest. How old are you? And what type of sickle cell do you have?
I was born and raised right here in Indianapolis. At the time it was called General Hospital. I am 62 years old and blessed to be 62. They said I wouldn't make it at that time. They didn't know anything about sickle cell, so they just estimated that we wouldn't live that long. And I'm doing well with it.
Did they tell you, Darlene, did they give you an expectancy? Because sometimes they do. Did they tell you?
Years.
They told you 30 years. Okay.
Uh-huh.
And that was a practice that really was not handled very well in many occasions, from what I've heard. So,
right.
And what type of sickle cell do you have?
I have the original disease, SS.
The full sickle cell
Full-blown
SS.
sickle cell.
Okay.
Yes.
Now, Darlene, are you the only one in your immediate family who has sickle cell?
I am the exemplary family. My parents had the trait. I had the disease, and I have 2 siblings with the trait.
With the
My
trait.
sister.
So you're the only one
The
of
only one
the
with the
siblings
disease.
with the disease. And is there anybody else in your extended family that you're aware of that had sickle cell?
My niece has the trait.
Okay.
And I have a nephew that has the disease.
Okay. Does your nephew have sickle cell SS? Or?
Yes, he
Okay.
does.
Okay. So our show today is about aging gracefully with sickle cell, and I could think of nobody else better to talk to us about that today. But before we talk about how you've managed to do that, let's talk a little bit about how sickle cell has affected you personally. I know you can talk for a long time about that, and I'm going to let you talk, but if you go too long, I'll stop you, and everybody knows I do that too.
Yeah.
But the first thing I'd like to ask is when were you diagnosed with sickle cell?
I was diagnosed actually when I was about 5 years old.
Okay.
Because I had symptoms, but they didn't know what the disease was at the time. And so they diagnosed me as leukemia, different types
Right.
of cancer. And it wasn't until I really lost consciousness, and they gave up on me, actually.
Mm-hmm.
And then when they brought me back, that's when they rushed me and ran all kind of tests and found out that I had the disease.
Was that in a hospital setting?
Yeah, that was in the hospital.
In which hospital was that?
At General.
General? Okay, which is now
Eskenazi.
Wishart and now Eskenazi. Okay,
Eskenazi,
right. So, Darlene, if you would, tell us a little bit about your childhood. What was it like for you growing up with sickle cell?
With sickle cell, I couldn't do a lot of playing with the children, interacting with the children. I was in and out of the hospital quite a bit. I was, my spleen had fell down, and which caused a lot, problems. And I couldn't interact, go outside and play. I had to go into the hospital like every weekend. I would come home for the weekend, and then I would have to go back into the hospital for the whole week. And I would go kicking and screaming, and I had to have several surgeries, splenectomy, tonsillectomy. I had chicken pox, mumps, measles, all of these, and which were very detrimental. But I came through, and it wasn't until I was in my teens that I began to they finally put me up under a doctor, because I wasn't up under a regular doctor then. They found a doctor and who actually learned off of me with sickle cell. His name was E. Paul Thomas.
Well, I know him very well.
Yes,
He was my doctor.
Was he?
Yes, he
yeah,
was.
I loved him.
Uh-huh.
And he learned sickle cell, and I teased him and called him my second father, because he was very serious about it.
Mm-hmm.
And he kept me, very well. And he believed, I really wasn't sick during my teen and adult years. I didn't.
Mm-hmm.
I did well, after I came out of my childhood.
We see different patterns of that, and you've been around long enough and you've talked with enough sickle cell patients to see the same thing. There's different patterns where sometimes you start out with a lot of problems, and then as you get a little older, the problems go away until you get a little older, and then they kind of come back, and then we've seen it the other way, almost the reverse, where some people don't have a whole lot of problems when they're young, and then as they get older, they do have problems.
Yeah, they do.
So, okay. So all of those things turned you into a fighter pretty early, I would say.
Yeah, I have been. Actually, I was like any other young person, young teenager out there trying to do, live my life and stuff. And it was a friend of the family that worked at the Sickle Cell Center at the time.
Okay.
Under Dr. Harden.
Father Harden.
Father Harden. And she introduced me to the center, and that's when I became involved in the center, and that was in the early 70s.
Right.
And ever since then, I've been like a fighter, a warrior, for the disease. And I've done speaking. I would go around and speak to young people, and motivational on sickle cell. I still do a lot of times, you know.
Right. Darlene, what, you know, sometimes it's a little difficult question to ask, but what kind of support did you receive from your family as you grew up?
Oh, I had great support from my family. My parents, my dad worked several jobs just to have insurance to make sure that I had the health, you know, care that I needed.
Right.
And I had great support. I still have support from my family today.
Right.
If I'm sick, you know, even the ones from out of town, they'll find out. You know, most times I don't tell anybody, but they'll find out. I'll get a call, someone visit, you know. But I have great support now.
Okay. Okay. Darlene, how much do you remember about the type of medical care that you received as a child? You just mentioned how Dr. Thomas, who was an outstanding, wonderful man, you just mentioned how he learned about sickle cell in working with you. But taking him out of the equation, what do you remember about the kind of medical care you were receiving?
When I was younger, I was up under a doctor called Dr. Hummon. At that time, he was the only black doctor. So,
and he wasn't a hematologist, was he?
No, he wasn't.
Right.
He was just a general practitioner.
Right.
And he did the best he could. You know, I mean, he you know, when they found out, then he would make sure that I got hospital. You know, if I needed to go to the hospital, I was there at the hospital. He made sure I got the treatment that I needed. I always had good medical care. You know, like I said, my parents seen to it. I've seen my parents being advocates and fighting.
Okay.
You know, for things like even going into the emergency room and not being waited on, and my parents getting hostile and almost getting put out, you know,
because they're advocating for you.
Because I'm in pain. They know their child is in pain and their child needs help. So, you know, they're telling them, well, sir, you know, we can't put her back there. There's no bed. And my dad, I remember this so vividly, he marched back there. He said, well, you better find her a doctor and get her some medicine out here, and get her, or find her a bed out here with some medicine. And they immediately got a bed because he started marching back there. Okay. You know, so they were advocates too, you know. So as far as medical help, yeah, I got the best of it. They sing to it, you know. So I was just fortunate in that.
Well, we're about to take a break, but I want to ask you one more question that I often ask sickle cell patients, and it might be difficult for you, but how do you describe the pain of a sickle cell crisis?
That's something...
I know you've been asked this before.
Yes, and it's so hard to describe sickle cell pain because it's a pain you cannot describe. You was with us one time. We were down at the State House, and that's the only example that I can use that could really explain it. When one of the clients took one of the people that we were talking to sickle cell about and took his arm and twisted it.
Yeah, that was so cool.
Yeah, and kept twisting it, and the guy, he said, let me know when you ready for me to stop. But he wouldn't stop. Right. And this is how sickle cell is. It does not stop. And if you don't get on top of it, and that's what we have problems with in the hospital, trying to tell the doctors and nurses, when this pain starts, if you don't get on top of it, it's serious. It's not pregnant. You know, most women, like, I bet you it's not better, it's worse than pregnancy. But, oh no, I'd rather have one of those than to have sickle cell pain. Right. You know, so it's undescribable.
All right. And that was a pretty cool thing for those listening. We went to the State House for a State House Day, and we were trying to advocate to get more funding for sickle cell, which in fact we did end up doing. But as a part of the effort, one of our patients did in fact ask one of the legislative aides to, would you like to see a demonstration of what it's like? And I think he got the point across.
He did,
he got the point across.
Because the guy he didn't stop twisting his arm. In other words, he was trying to tell him this is the way it is. It does not stop.
Right.
Even after you try to stop it, it doesn't stop.
I thank you for bringing that up, because that was a really fascinating thing to watch, wasn't it? All right, we're going to take a break here at the Sickle Cell Action Network, and when we return, we'll continue our discussion with Darlene Ransom. This is the Sickle Cell Action Network Internet Radio Show, and I am Gary A. Gibson, your host.
Hi, I'm Gary A. Gibson, your host for the Sickle Cell Action Network Internet Radio Show. If you are impacted by sickle cell disease in any way, whether you are a patient, a caregiver, or a friend, you need to join me every Tuesday at 4 p.m. Eastern Time. I promise that you will find our show to be full of information, perspective, and opinion about all things sickle cell. See you Tuesday right here on RadioNext.tv, the Cool Groove site.
Welcome back to the Sickle Cell Action Network, and we are speaking with Ms. Darlene Ransom. Darlene is giving us a lot of information already, and there's a lot more to come. And we're going to start getting there, and I'm going to ask you, Darlene, so what about your schooling? Did you have a hard time getting through school because of sickle cell? And if so, please explain why, and if not, maybe tell us why not.
No, I didn't.
You didn't. It is a big issue for a lot of people.
It is, and and I often wonder, well, I guess different, people, different things, but my parents didn't believe in that. Yeah, I would have come in, my little hands swollen up, from the snow, ice, and cold. My mother would put a pot of water over the register, tell me put my hand down in there because you going to school tomorrow.
Okay.
So I didn't miss days like that.
Okay.
So I came out when I didn't miss like 18, 20 days of school or anything like that. And I went on, to college and graduated. So
that's interesting, because I think I don't remember exactly when it was, but in the Sickle Cell News Update section of a few shows back, we read a article about that same kind of thing that said parents that are, I'm trying to remember the word, but basically, what's the word? In other words, they were saying parents that freak out and treat their children as if it's a catastrophe. That's the word, catastrophe. They tend to make their kids less resistant to the struggles and rigors of sickle cell. So, in other words, by treating them in a catastrophic manner, they make the kids weaker.
Right.
And so what you're telling me kind of bears that out, because your mom said, tough it up. You're going to school tomorrow.
You're going to school tomorrow.
Right. That's an interesting thing, and it may have something to do with your longevity, and that's why that's important to bring that out.
That never anything. My dad, anything, he would always tell me, if you want to do anything, you just have to try harder. If you want to be a cheerleader or whatever, you go out there and you try harder.
Right.
But you're not going to stop.
Right. Did you do cheerleading?
I tried it.
Okay.
But I didn't make
you
it.
did you did modeling too,
I did
right?
Modeling.
When you were
I modeled and I traveled, and stuff, and now they did keep me from making my first airplane.
Okay.
Flight, because they, were under the impression that airplanes didn't have wasn't pressurized at that time.
Right.
And I missed my first flight.
Okay. Okay.
But yeah, I traveled, and I led a normal life.
And then, speaking of that, leading a normal life, what about work? You're not working now, but did you have work experience in the past? Tell us a little bit about what you did.
Yeah, I've had, I tell everybody I'm a jack of all trade, but a master of none.
Right.
I've done some of everything. I've been in retail. Like I said, I modeled. My main thing was business office work. I did a lot of that. I worked at the Sickle Cell Center half of my life, as client coordinator and office work, and then I wound up running my own daycare.
Okay, right.
And that just recently, I just stopped doing that about maybe 4 years ago.
Did sickle cell have any impact on some of the other employment, not necessarily what you were doing as self-employed on your own, but when you were working at the retail or anything like that, did it cause you, like it does some people, to lose a job because the employers weren't understanding? Did you ever run into that?
No, because I was upfront with them.
There you go. Right.
I never did, because I did try to do that, and my parents were the type that you don't lie about anything, So, and you wasn't going to get nowhere doing it anyway. So I just told them up front that I had this disease, but, that wouldn't stop me from being the best person for the job. And most of the time I got the job,
right.
And it didn't affect me.
And that's definitely then something that you recommend to people, is to be upfront. We've had, this is our 45th show, and we've had different people on here that have been honest and have said, well, I didn't tell them.
Right.
I didn't tell them.
Right.
And then boom,
right.
they get
fired.
They get sick and they get fired. Right. So you have the other approach, which is just be upfront. Great. So one of the impacts that sickle cell has on people is the financial burden that it comes with it. And I've spoken to many patients who do have thousands and thousands of dollars of medical debt. Is that true for you?
Yes, it is.
Okay.
Yeah.
And how do you manage that?
The best I can, right now I'm on disability, and it only goes so far.
Right.
So whatever the Medicaid and Medicare can't pay, if I don't get Parton or whatever, or get on some type of program, scale down program, whatever, it's hard.
Yeah, it is, and for me, it's been one of those things that I really, really push as being an issue that we need help with.
Yeah.
And one of the things that I wonder about is how do you manage it from a stress point of view? So why is that important? Of course, keeping stress low is a good thing for somebody with sickle cell disease.
It is.
Having burdens like that, big medical bills, is a source of stress. How do you manage through that? How do you make yourself keep that in proper perspective and not be overwhelmed to the point of being stressed where it's affecting your health?
I've come to the conclusion I can't do nothing about it.
Okay. Okay.
Basically, and then
just accept it.
I have to, because what can I do about it? I don't have it.
Right. Right.
And if you call the people and you make arrangements, okay, the arrangement may last for a minute or so, but then something will happen, you get sick again, there's another bill on top of that.
Right.
So, what can you do? And you just have to try to just deal with it and go on, because if not, you will stress yourself out and you will be sick.
Right.
I've been in that situation.
Right.
And I've had to learn to pray a lot, and just give it to God and let Him deal with it, and and just go with it from there, because I ain't got time to stress. I got to go on.
Right.
I got to live.
Right.
And they're going to be there. The bills are going to be there. If I can't handle it, then there's nothing else I can do.
Well, I do know of one particular sickle cell warrior who passed away at an age younger than yours, and I do believe from all of the evidence that it was the financial stress that took her to the point of having the complications that she had, which ended up causing her to pass away, because she was just overwhelmed with her financial burden, and she was very serious about trying to live up to her burden and her obligations, and she didn't have the same attitude that you just talked about. So the stress just got her.
Stress, and they tell you, actually, stress is the number one thing that we need not to have with sickle cell, because I've been through it, and it will take, and stress is something that you cannot diagnose it, and you don't know it's happening. And most people, if you ask them, well, are you stressing about anything? It's like, no, I can't think of anything. But most of the time, you are stressed, and that just goes with even normal.
Well, I was about to say, I mean, everybody's got to worry about stress and the impact that it has.
But, if you can't do anything about it, then why worry
then
about.
Why stress?
Why stress about
And
it?
so I think one of the takeaways with our topic for today of aging gracefully with sickle cell is being able to manage your stress, because that helps you manage this and get beyond those life expectancies that most people are afraid they'll never get beyond.
Right.
Okay, so thank you, Darlene. I think that's very, very helpful. So as you know, Martin Center Sickle Cell Initiative is working on a brand new project, and we've talked about this before in the show too, our Emergency Department Sickle Cell Education Project, and we're doing this because we got tired of hearing about the lack of knowledge and the cultural insensitivity that we see in emergency departments and emergency department staff. How would you describe your experience as an adult in the ER? Now, this may be a little different because you've got your act together, and I've watched it. You've talked to me about it. You've got your act together, but have you had experiences in the ER that you think you would like to share with us?
As I told you before, I don't do ER.
You don't do ER. That's what I wanted to come out. That's what I wanted to come out.
I really don't, because of the experiences that, I've had experiences where I've had to sit out there waiting in pain, and they really don't care. They don't care, and
now the doctors that we've been talking to in this project tell us they care.
But doctors don't know you out there,
right,
until you get back there.
Right. I'm telling you, right.
And so the receptionists and the nurses and stuff out there, well, we don't have a bed, you have to wait.
Right.
And I'm in pain though, and so they just don't care.
So you don't go to the ER. What do you do?
I go to the office.
You go to see the doctor, and you go to your hematologist.
I go to the hematologist and let them put me in the hospital from there.
Okay.
And they know that I'm not going to the ER. A lot of times I've been so sick, and I have driven myself to the clinic, and they're like, "How did you get here?" I drove. Mm-hmm. And well, you're not gonna drive back home.
Right.
We get ready to put you in the hospital. They'll put me in the hospital from there. I don't do ERs. I can't.
Okay. How long ago did you start that? Or
it's been about. I say it's been going on 10 years now.
Really?
I just don't do it.
Okay. So this is something you might advise other sickle cell patients to do?
Just go to your doctor office. Even when I lived in Vegas, I lived in Vegas for about 3 years. And my doctor, I would go to his office and have them to put me in the hospital. I would not go to the ER. And I'm out of town too. They don't know.
Right.
So no, I'm not going.
Right.
To the ER.
Okay. What are some of the first thoughts that might come to your mind, though, if you think you're going to have to go to the ER? So, let's say that you do take a trip and you go somewhere, and so you're not near your regular hematologist, and you're not there in Vegas where your other doctor was, where you had that arrangement. So, what if you go to Florida or something and you get sick, and your only option maybe is to go to the ER? What would be on your mind about that experience? What would you be afraid of? What would you think?
What would be on my mind is them, me not knowing, and I don't know. I'm like, do they know anything about sickle cell? Or, and like sickle cell is just here, But if I'm going somewhere else, I'm sure they do, but they don't know me, and they don't know my situation, So if I do that, I have gotten so now I'll have the doctor to print up a paper on top of the card that I have that Dr. Grice had given me.
Okay.
Just in case I have to go to the ER, where I can present this and let them know, because I don't want to get in there in pain, and then I'm going to have to go off, because I'm in pain. And I'm just, I'll just have the papers ready to show you, and we can go from there. But going through my mind at first is going to be, anybody would wonder, well, they don't know me, they don't know my situation, who am I going to get? Does the doctor know anything about sickle cell? Does the nurses know about, how am I going to be treated? So that would just be normal, really, for anybody.
Yeah, that's why I wanted you to say that, because that's what's always on people's minds. Okay, well, thank you, Darlene. We're going to take a break, and when we come back, we'll continue our discussion with you. And this is the Sickle Cell Action Network. And welcome back to the Sickle Cell Action Network. And we are speaking with Darlene Ransom. And we are learning a lot about going through life with sickle cell disease. And I think as you listen, you'll see why we call this show Aging Gracefully with Sickle Cell, because Darlene is a graceful person, and you can tell from her answers that what she has done to get to this point in her life, she's done gracefully. So again, we're thanking Darlene for giving herself to the cause today, to share herself with us and with our audience. Darlene, you've been a client member at Martin Center Sickle Cell Initiative just about since the very beginning. And in fact, I think that makes you probably our longest running member. That means that you have found value in the types of services that agencies like ours provide. So in your own words, would you tell us why sickle cell agencies like Martin Center are so important to the sickle cell community?
I think they are important because a lot of the services you can't find for sickle cell anywhere else, and so I think it's important to have these centers to open to provide these services, and then it's a place where the clients can come and get to know each other, fellowship with each other, and the services, because they may have a hard time just in general going to get these services that are out there. Whereas if you come to the center, they can help you, guide you through it, to get the services that you need. So I think it's awesome, to have the services and the centers.
So if I told you that there were only 40 to 50 such centers around the entire United States, what would you say?
I think that's a travesty.
Yeah.
I really do. I think, just because of the disease, I think we don't have a lot of things, because of the disease per se. There's not a lot of financial backing, and as I tell you all the time, because of the awareness and education, it boils down to being educated about the disease and getting the awareness out there. People don't know, even the ones that have sickle cell.
Right.
They don't know, and then a lot of ones, now the younger ones, they don't care.
Right.
It's and it has to be more awareness, and so dealing with the finance, getting these places open
and keeping them
open. That's the problem. They probably open, but they just don't stay open because they don't have the participation from the clients, that are out there,
You touched on something too that I'd like to explore just a little bit, and that's the ability or the opportunity to fellowship with others with sickle cell at centers like Martin Center. And that's really important, and I don't think that that's something that happens enough.
It doesn't.
Right?
It really doesn't.
Do you have any ideas of how we could foster more of that? I mean, we try our doors are open most of the time, and we try to tell people we want you to be able to meet others that you can fellowship with, that you can become friends with, that you can support each other, and we see some of it. We do see some of it, and you're one of the ones that does that. But what about the others? What do we have to do to reach them? What do you think?
It's hard. Like I told you, I think it's the generation now, because back, and I always go back to, when the center back in the olden days, it would be packed. We would have support group. It would be standing room, It was like a family. But now it's like the younger generation is just they have so much other things on their mind till they don't. You know, I spoke with you about my nephew with sickle cell. He got himself caught up, and he's locked up. You know, and now I'm trying to get some help. You know, help him as far as his health inside the system, because there's no education about this, the disease. You know, we need to go into there and educate the staff and stuff on how to treat them. So, you know, this younger generation, it's hard to get them to do anything like that. They ain't got time.
What's really interesting, you know, we've talked about how social media has been a really good thing for sickle cell, because it's helping people connect.
And I think that's one of the problems.
But it's also one of the problems.
One of the problems, see, because of that, they ain't coming.
They don't have to come to the center, because they can sit at home and get on their phone and
computer and stuff.
So wow.
So it's a good thing, but it's a bad thing.
Right.
You know, so.
Well, as an example, though, I mean, social media has connected so many people in such a short amount of time, and I'm fond of it, and I've talked about this, that it has helped a lot remove the isolation barrier where people with sickle cell didn't even know there was anybody else with sickle cell, and now but what it's doing is it's keeping them from coming out. So
you know, I mean, and that's just with everyday people. They're talking about their children. Children don't know how to associate with each other anymore. They don't know what a phone is to pick up or write a letter. You know, because everything is done over the computer. You know, they don't communicate with each other anymore. They don't talk. They'll stand right next to each other and
text each other. I find that hilarious, but it's true. Know, it's absolutely
that's
true.
One of the problems right there, you know.
So, Darlene, let's start talking about today's topic in a little more detail: aging gracefully with sickle cell. And as a sickle cell patient in your 60s, you've clearly beaten the odds given to you by the medical community. First off, how does that make you feel to know that?
I think I'm blessed. I feel good about it. I really do. You know, and people, you know, about your age, I'm glad to tell my age. I have no problem when people ask me my age, you know, because I feel like I'm blessed, you know. Like I said, they told me I wouldn't make it until I was 30. But I done lived 32 more years. you know, and looking to live 32 more years, you know, but I've beaten the odds.
Well, we've talked about, oh gosh, I wish I could remember her name, but grand lady in Africa who just turned 90 with sickle cell. So it's definitely possible.
It's
you know, it's definitely possible.
And it just depends on your attitude, how you take care of yourself. I've had doctors to come and ask, how do you, you know, because I've gone through some of the worst types of situations with my health until they didn't know how I came through it. But they also commented and talked about your attitude. And your attitude means a lot. So when you know, because a lot of times you can't, and you know, like I told them, well, what can I do? You know. Well,
you're sort of getting ahead of me, because you're answering in a way than my next question, but that's okay. And so my next question was that, you know, I'm sure our listeners are interested in how you answer this question, and what is it about you, and what strategies have you used that have allowed you to defy these odds like you have? So your attitude, that's what you're saying. Your attitude is one thing.
Your attitude means a lot. You know, it carries you a lot, because most of the time when you're sick, there's nothing you can do but what the doctors are doing, and they can only do so much. You know, God gave you this body, and it's His. So, you know, and I just have, like I said, I've gone through situations where they thought that I was not going to make it, period. You know, and that was just within the last 4 years when I had a situation, a disease that came up that was really a rare disease that actually took me out, almost took me out of here. And the doctors were amazed, because most people that have that disease don't come out of it. period. So the odds of me making it wasn't that good. And they even put me in a long-term hospital with people that were on ventilators, and it was so funny because the nurses and stuff wouldn't even make my bed up because I'm up walking around. And when I left there, I walked out. Most of they couldn't believe it. They sit down, they couldn't believe it that I was walking out of there, because most people were going out on stretchers or in beds going to nursing homes and stuff like that. So it's just your attitude and your faith.
So, if it's your attitude, which obviously that has a whole lot to do with it, how do you keep that attitude? What do? You pray. You pray,
lot.
Okay.
You pray a lot, And I was raised, and with having this disease, I tell everybody, I'm not, like the doctor told me this weekend, he said, well, you were lucky. No, I don't deal with luck. I was blessed. I don't deal with luck. So yeah, I was blessed. Okay. And so I consider that I'm blessed.
Okay.
And so that's where my attitude comes from, being blessed.
Okay. Is there any other strategy that you use to help you?
As far as, it may not work for a lot of people. I have started going to a wellness center.
Okay.
Where they use a lot of holistic medicines and treatments and stuff that I found was very helpful. Now, it may help me, but it may not help others.
Right. Right.
But I found that to be very resourceful.
Okay. Okay.
And massages. I mean, even the doctors are trying to get that in the hospitals. Are very helpful. Massages. If you can get a massage, which I go usually once a week, it really helps as far as pain-wise, as far as your mentality, stressing and stuff. It helps, So, yeah, those, and then your how you eat.
Okay.
And water plays a lot.
Okay, so you drink lots of water.
Lots of water, and I drink, it's called alkaline water, which is good, which helps rebuild the cells in your body and stuff. So I drink a lot of water, constantly. And, just exercising, what you can do. A lot of us, I used to be an exercise nut, I was constantly exercising. And I think that helped me a lot, But a lot of them don't want to exercise because it's painful, like you said. That's the way they were raised and stuff, and it hurts. And well, life is pain.
There is pain in life.
And life is not fair, and if you're looking for fair, I tell them it's up on 38th Street.
Is it on East or West? Right. Yeah, I was like, it's up there somewhere. You have one of, I think, the best adult hematologists in Indiana, if not the country, caring for you. And I'm speaking of Dr. Ann Grice of the Indiana Hemophilia and Thrombosis Center. And she was on our show back in April, and of course she did a great job explaining how she takes care of adult sickle cell patients. And since I think it's important for sickle cell patients to have strong relationships with their healthcare providers, would you mind telling us a little bit about your relationship with Dr. Grice? How long have you been going to her, and what is it about her that makes you keep her as your hematologist?
I love Dr. Grice. I really did. I am so glad that I was introduced to her by Miss Smith, used to be at the center. At the time, I was looking for a doctor, and she referred me to Dr. Grice, and that's been about 30 years now. And our relationship is very, very good, She is, she's the type of doctor that is very thorough and knows, about adult sickle cell, and she is genuine.
She is.
She's very genuine, And she knows her stuff, and she researches, and so she can tell you just about anything. And if you need her, she's there. Most of the time we don't get to see her now because she does a lot of research, she does a lot of traveling and stuff, but she has comparable people that take over for her. And but she's just a special person. And I told her, and they were saying, well, you need to get a doctor, a regular doctor, because Dr. Grice she's getting so overloaded with patients. And I told her personally, I said, now, I'd have been here about over 20, so I'm not going nowhere. Now, you can tell the new ones to come in, have them to find a doctor, but you are my doctor.
Right.
Because she's known as a specialist.
Yes.
So she's not per se a general doctor, but she's a specialist. Well, she's my specialist, and I'm not going nowhere. So we just have that type of relationship, and I love her.
Well, she's great, and a lot of people that have her as their hematologist say the same thing you do. So obviously there's something she's doing well. Not only does she know her stuff, but somehow she connects with her patients, and her patients love her. So that's probably an important part too of being able to have this longevity is being able to have a good relationship with your healthcare providers. And we'll come back to that after we get back from our break, but we are going to take a break right now. This is the Sickle Cell Action Network show. Gary A. Gibson, your host, right here on RadioNext.tv, the Cool Groove site. Welcome back to the Sickle Cell Action Network show. The Sickle Cell Action Network show is brought to you by Martin Center Sickle Cell Initiative and sponsored by Mass Therapeutics, a publicly traded biopharmaceutical company headquartered in San Diego, California. MAST is currently leveraging the molecular adhesion and sealant technology platform derived from over 2 decades of clinical, non-clinical, and manufacturing experience with purified and non-purified polaxamers. MAST has developed a drug called MST-188 as a candidate for serious or life-threatening diseases with significant unmet needs. Among those needs is the treatment of sickle cell disease. MAST has enrolled sickle cell patients in a clinical trial known as EPIC. EPIC stands for Evaluation of Purified Polaxamer in Crisis. If successful, EPIC could result in the first treatment of its kind to treat sickle cell disease patients while they are in crisis. The EPIC study aims to determine whether MST-188 can shorten the duration of a painful crisis. MST-188 is an investigational drug that has not been approved for commercial sale in any jurisdiction for any use. MST-188 potentially improves oxygen delivery, and it may help keep blood vessels from becoming blocked and more obstructed. It may improve blood flow by stopping cells from grouping together. It also may reduce inflammation, and it may restore cell membranes and give damaged cells time to heal. EPIC participants continue to receive their normal pain treatments during crisis, and their participation is free of charge to them. The patients involved in the EPIC study may not only be helping themselves, but they might also be helping future generations of those yet to be born. If you are interested in learning more about the EPIC study, please visit www.theepicstudy.com. So speaking with Ms. Darlene Ransom, a 62-year-old sickle cell warrior, and we were just having a delightful conversation, and she's herself today and just coming out just as she usually does, straight up and honest. And so we have talked about a number of different things, all of it geared towards trying to give guidance to those listening as to how do you age gracefully with sickle cell disease. And before the break, we're talking about a relationship with the healthcare providers and how important that is. And she spoke very well about one particular doctor, her hematologist, and the relationship that they have. And I would like to follow that up, Darlene, with another question, which is, what about other healthcare providers? Do you regularly see other specialists? And if so, what types of specialists do you see?
Yeah, Dr. Grice or either the nurse practitioners. If it's anything else, they'll send you to a specialist. I've seen neurologists. I've seen rheumatologists. I have a cardiologist. Those are just some of them that I see regularly. And they will send you to other specialists.
This is really an important topic because we've talked about this before too, is that because of the nature of sickle cell, it can impact any part of your body.
Right.
And you do not want to neglect any other part of your body because you can have irreparable damage made to those parts of your body. And one of the easiest ones to talk to people about is see an ophthalmologist. Go see your eye doctor, and have regular checkups with your eye doctor because an area that sickle cell affects quite frequently, in fact, is the eyes. And other elements like you mentioned, the rheumatologist. We need to go see the cardiologist. We need to see the pulmonary specialist. We need to see all of those people, unfortunately. But in order to ensure that you are monitoring all of your systems that can be affected, this is highly recommended. So you do agree with that then?
Yeah, I do.
Okay.
I do. And then we go back to the financial part too.
Yeah, it does.
Because they're expensive.
Sure.
They really are. And they recommend you to go to your, they'll send you to ophthalmologists wherever you need to go. But that goes in. But you do need to. And then speaking on aging, all of this comes into play with aging. More so.
Right.
When you get older, on top of the sickle cell, you do have these other problems.
Right.
That come up. And so that happens.
So we sort of touched on this, but just to be sure we don't leave anything out there, are there any other things that you do that you think have helped give you your longevity? So you talked about food, what you eat, and then you talked about exercise. So let's get a little more specific about that with your food. For instance, what about your diet? What do you recommend for people as far as diet is concerned?
Me, myself, I eat a lot of fruit. I love fruit and fresh vegetables.
Okay.
I don't do a lot of meat per se. I may eat some chicken, fish sometimes. I like fish, but sometimes you just grow tired of certain foods and stuff.
Right.
Red meat, not so much, but you need to get your protein. So I may eat a steak or something every once in a while. But plenty of fresh vegetables. I love fresh vegetables and fresh fruit.
Okay. How do you prepare them?
Most of the time, fresh fruit, I'll cut it up and eat it.
Okay. What about the vegetables?
Vegetables, I'll usually steam them or boil them, and grill them. You can grill them and stuff.
Do you avoid deep fried foods?
Right. I do not eat a lot of fried food. Period.
Right.
I can't recall when I've eaten a lot of fried food.
Okay. And then what about any special exercise routines? You made a mention about that a while back, but you said whatever you can do, and that's important. Don't do something you can't do.
You can walk, and even sitting down, you can do something. Like sit and stand. Or walking is a great exercise. Just to get out and walk. I'm not gonna say run because most of us can't run.
Especially when we're in our 60s,
right? Thank you.
Yeah.
But you can do a few sit-ups on the floor, or on the side of your bed, or it's a lot of things that you can do. Water aerobics are very good.
Okay.
At the gym, do water aerobics. I belong to Planet Fitness.
Okay.
And I go there and get on the treadmill if I don't walk outside, which I don't.
Right.
But you can go there and get on the treadmill and walk, and then they have a stair, things that you can walk. Just do what you can do.
Okay. Now let's shift gears a little bit. Do you have any heroes or people that you look up to help you maintain your determination and strength?
My sister is one.
Okay.
I look up to her. And my pastor is another. my aunt. I have a great aunt. She's not my great aunt, but she's my aunt. But she's constantly, she's hilarious, and she keeps me grounded.
Okay. Right. Right.
And when my mom passed, all these people kind of came into play, as far as watching over me and stuff. So
Okay.
yeah, I think those are my heroes.
Okay. Okay. And then what about faith? You've touched on it a couple of times. Does that play any role?
Yes, I have a deep faith.
Okay.
I can't make it without my faith. That's something I think plays a major part in, I believe, in healing a lot of times, when I'm sick and stuff. And I believe that's why I've come this far, because of my faith.
Okay. All right. So I do want you to know that I admire you for who you are.
Thank you.
And I believe that you're the ultimate when it comes to being a sickle cell warrior. You're exactly what it means. Not only have you shown your inner strength in your battle with this condition, you've also given of yourself to the sickle cell cause, and you touched on that a little bit too. You've also given yourself to other causes as well. You get involved in politics,
Yeah.
and things like that.
Yeah.
But when it comes to sickle cell, you've been an effective advocate, and in fact, you are even now serving on the Martin Center Board of Directors.
Yeah.
So, one simple question: what drives you to share yourself like you do?
I've just always been that type of person to want to do and reach out, to help others or to help where I can. I've been a giver per se, and to let people know, or to reach out, like I said, just to help people, so I've always, my mom used to tell me all the time, that I was a giving person. Sometimes I overgive, I overdo it, and stuff, but that's just me. I just give, and I'm not looking for anything in return.
Right.
I'm not looking for any accolades,
Right.
or no, to brag or boast or anything like that. I'm just me. That's just me.
Well, I think part of the reason I asked the question in the way that I do is that sometimes it occurs to me that the main reason that we're all here is to help somebody else.
Right.
So I wonder, in this philosophy that you have of giving of yourself back to others, do you think maybe that helps add to your longevity too? Because you're not just focused on yourself?
Yeah, because, a lot of people
and
say,
your
when
problems?
you going to take care of yourself, you always helping
Right.
others,
Right.
When are you going to take care of yourself?
Because too much focusing on yourself can be a bad thing.
Right,
Right.
yeah, but then you do have to take care of yourself
You do,
too.
you do.
You have to look out for yourself, but I tend to go overboard in helping others and not looking out for me a lot of times, so that's where I fall short, but that's just me, and I just get a thrill out of it. I really do, You mentioned the politics and stuff. I get a thrill out of all of that.
You get out there and you work the polls and you work on campaigns and stuff like that.
Yeah.
And people want to have you there, which is another good thing too.
Yeah.
So, Darlene, let's imagine that you had a chance to talk to a group of young boys and girls at a conference for sickle cell. What would you tell them to keep them motivated to grow up and be strong, a strong sickle cell warrior like you? What would you tell them?
First, I would tell them, their attitude can be a major part of their living, and how they conduct themselves, and the thing of respecting themselves and their bodies, to take care of themselves, and have faith and trust in God, and not on, and when you do that, then you can have faith in yourself, and you will do better with yourself, but take care of yourself, and like I said, your attitude goes a long way. It's your attitude, not the altitude, the attitude, to and take on challenges, because I always tell young people sickle cell is a part of me. I'm not a part of it. It doesn't control me. I control it.
Mm-hmm.
So therefore, when you have that attitude, then you can go far.
Mm-hmm.
You can go far. Don't a lot of them let sickle cell conquer them.
Right.
They think that I have this disease, so I can't. No, ain't no such word as can't.
Right.
That's not even in the vocabulary. Because you can do anything that you put your mind to.
All right.
You can reach for the stars. You can reach for, and you can do it.
Yes.
You can do it.
So I often ask a question like this too, as we get near the end. But so let's say, I don't know that he does it so much anymore, but every now and then in the earlier days, President Obama would just call people up and talk to them. So let's say you got a phone call from President Obama and said, "Hey, I heard you have sickle cell disease, and I'm trying to do something about sickle cell before I go out of office," which we all wish he would do. We've been pushing on him for all this time to do something. So what if he did call you up and he said, "Darlene, tell me, what's the one thing you think we need to do about sickle cell?" What would you tell me?
I would tell him, for one thing, I'm glad you called me. I've been waiting for you to call.
Been waiting for 8 years
for
you to call me.
8 years for you to call, because, we need help in this field. We need to get the word out. We need more education. We need more awareness, We need to get bills pushed in the, so that we can get the funds coming, the money rolling,
Right.
So that we can get cures and medicine and stuff. It's a lot that you can do. That can be done on the presidential or the Senate level or the legislature. You are the head. You can do this. So we need to get the education and I would say the education, awareness, and the financial part.
Right.
Is what we need, basically, right now.
Okay. And I would agree with you. Is there anything else that we haven't covered already that you'd like to add at this time? Remember, you're talking to people all around the world.
No, I think we've covered everything. I just hope everybody, just be blessed and take care, the best they can. Do the best you can.
Okay. Well, you've been great, and we appreciate you being here, taking your time to share with us once again, to share yourself with the community, and we thank you for that, Darlene, and we thank you for the example that you give. We can show you and tell people that yes, you can live past those life expectancies, and yes, you can accomplish something that you do. So we're going to close out the show, and as usual, I always feel like I got to leave people with something to think about, Darlene. So here's what I'd like you to think about today, and I'm going to start with a quote from a guy named Art Buchwald, and it goes, "Whether it's the best of times or the worst of time, it's the only time we've got." Art Buchwald lived from 1925 to 2007. He was an American humorist, best known for his long-running column in the Washington Post, which in turn was carried as a syndicated column in many other newspapers. His column focused on political satire and commentary. He received the Pulitzer Prize for Outstanding Commentary in 1982, and in 1986 was elected to the American Academy Institute of Arts and Letters. Today's show has been about aging with sickle cell disease. This is a really important topic because of the impact that sickle cell has on a patient's life expectancies. Many, if not all, sickle cell patients live under a cloud that hovers above them day in and day out. The cloud represents the question of how long they will live. Their doctors have told them that they would not live to see old age. Sometimes the doctors have told them that they wouldn't even live to see their 21st birthday. Sometimes the doctors have done this in a manner that really borders on being unethical. You know what I mean. Like when a doctor tells a 10-year-old boy that he might not even live long enough to go to college. If it isn't unethical to do that, it certainly is a questionable thing to do. Don't you agree? For those who don't have sickle cell, I want you to imagine what having that kind of information could do to you and your psyche. how motivated would you be to try to make something out of your life? Would you even be able to find a way to get some joy out of what little time you had left? Sure, we all know that life expectancies are an uncertainty for any of us, but to have some menacing voice in the back of your head telling you that you only have so much longer to live is a different thing altogether, isn't it? Would you be able to handle that? Well, most sickle cell patients don't have a choice. They have to handle it, and most of them do it better than I think I ever could. For those who do have sickle cell, I want to encourage you to keep things in perspective. For example, as a man in my early 60s, I know that my average life expectancy means that I may have just a decade or so more to live. That same statistic applied to all of the other boys and men my age that I went to school with. But guess what? Quite a few of them are already gone. Some of them have been gone for many years. They didn't have sickle cell, but still something else led to their departure from this planet way before they were scheduled to leave. Interestingly, many of those people passed away at younger ages than a lot of the still living sickle cell patients that I know. People can try to do everything right, from lifestyle to diet to getting the right amount of exercise, only to have their lives be shortened because of something entirely out of their control. Remember, lifespans are composed of averages, and averages are just statistics. They are derived from calculating numbers, highs and lows included. Yes, some sickle cell patients are still dying at early ages, but that pattern is changing for the better. In fact, the life expectancies for sickle cell patients have risen dramatically in the last few years. That means that there are more and more patients on the higher end, and fewer patients on the lower end of the lifespan. All of this means that we should only pay so much attention to these lifespan statistics. What's important is that we remember and take to heart what Art Buchwald said. Whether it's the best of times or the worst of times, it's the only time we've got. And that, my friends, pertains to all of us. So let's all start doing something positive with